Hi, my name is Florence. I am the osteopathic manual practitioner here at Proactive Pelvic Health. Today I wanted to talk about castor oil. So castor oil is one of my favorite tools and such a powerful tool for continued care and home care for my patients who are dealing with recovery from abdominal surgery, such as any type of laparoscopic surgery or a C-section, as well as people who have or are ongoing dealings with endometriosis and pain or abdominal pelvic pain due to endometriosis. So castor oil can be found at any health food store. It is very thick and viscous, and it will stain and ruin any type of nice clothing you have on. So make sure, I always say, make sure you have had a shower, you've cleaned the area, potentially exfoliated the area with the scarring or the abdominal region if you're dealing with just overall abdominal dysfunction or abdominal pelvic dysfunction. Then you can place about 1 to 2 teaspoons of the oil in the fingers. And you can't quite see here, but it's very viscous, it's very thick. And from there, heat up the oil a little bit in your fingers. You can rub it in between the hands and then use your hands to massage the area. So whether or not that's the scar, potentially it's the local scar, or potentially it's a more global abdominal massage, starting from the right lower quadrant, moving your way up, across and down towards the left. After that, after doing that about for 5 to 10 minutes, you can choose to maybe place a towel or an organic piece of cotton over the abdomen and then apply a heating pack or a hot water bottle and stay and rest with that on the abdomen for about 30 to 45 minutes. What this does is it increases circulation, it promotes elimination and healing of the tissues and the organs underneath the skin to which you've applied the castor oil. I typically recommend it 2 to 3 times a week and avoiding the application of it around your menstrual cycle.